Welcome to the deep dive. Today we're tackling a topic that, well, I think causes a fair bit of worry for pet owners' fever in our dogs and cats.
Oh, absolutely. Seeing that temperature climb can be really concerning.
Yeah, exactly. So we've gathered some solid veterinary insights, and our goal today is to really get under the hood, understand what's actually happening when your pet spikes a fever.
Right. Because it's more than just a number. We want to explore, the why behind it, the body's reaction, what kinds of things cause it, and importantly, how vets figure it out and what the treatment looks like.
Hopefully demystify it a bit.
Exactly.
Yeah.
And maybe uncover a few surprising things along the way, give you some practical knowledge.
Okay, so first things first. When we talk about fever in pets, it's not just them feeling hot to the touch, is it? What's the actual definition?
That's a key point. No, it's not just being hot. A true fever is a regulated increase in body temperature. It happens because the brain's thermostat in the hypothalamus actually gets reset to a higher set point.
Ah, okay. So the body intends to be hotter.
Precisely. And for dogs and cats, the normal baseline temperature is generally between 100.2 and 102.8 degrees Fahrenheit. That's about 37.8 to 39.3 Celsius.
Good numbers to remember. So what happens when it goes up and stays up and vets can't immediately figure out why? I think I saw something called FUO.
Yes, FUO, fever of unknown origin. That's a specific term vets use when things get tricky. It generally means a temperature of at least 103.5 Fahrenheit on, say, 4 different checks over maybe 2 weeks, and the pet's been sick for that long without an obvious cause popping up.
Wow, okay, so that's when the real detective work starts.
It really is.
Yeah.
FUO highlights just how complex these responses can be. It pushes veterinary diagnostics. It's quite the puzzle.
Let's get into the mechanics then. How does this thermostat reset actually happen? What kicks it off?
Well, it usually starts with things called pyrogens. Think of them as fever-inducing substances.
Pyrogens.
Yeah.
Yeah.
And they can come from outside the body. Those are exogenous pyrogens, like toxins from bacteria or parts of viruses.
Right. Invade.
Exactly.
Mhm.
Or the body can produce its own endogenous pyrogens in response to things like inflammation or tissue damage, even some immune reactions.
So internal or external triggers.
Correct. These pyrogens basically send signals up to the hypothalamus telling it, hey, turn up the heat.
So the body deliberately raises the temperature set point.
Yeah.
What happens then? How does the body react to that new setting?
Well, once that higher target is set, the body works to reach it. You might see shivering that generates heat. Blood flow to the skin might decrease to conserve heat, and the overall metabolic rate goes up.
Okay, so it's an active process, but you mentioned consequences.
Yes, there's a downside. This increased metabolic rate means the body needs more energy, more fuel. It can even start breaking down muscle tissue for that energy.
Oh, wow.
Yeah, and bone marrow function can get suppressed, which affects blood cell production. The pet needs more fluids, more calories. And in really severe, prolonged fevers, this can cascade into dangerous problems like DIC, disseminated intravascular coagulation.
DIC, what's that?
It's essentially the clotting system going haywire. You get both abnormal clotting and bleeding. It's very serious. And shock can also occur. So fever isn't benign.
No, definitely not just a number. It sounds like a major physiological event. Which body systems feel the biggest impact?
It's pretty systemic. The cardiovascular system often responds with a faster heart rate, tachycardia.
Makes sense. Working harder.
Yep. Then the blood and immune systems, what we call the hemic, lymphatic, and immune systems, can suffer from that bone marrow suppression and potentially DIC. And the nervous system isn't spared either.
How so?
There's a risk of brain-swelling cerebral edema, especially with very high fevers. And you'll often see lethargy, that profound tiredness.
That sleepy, unwell look. Okay, now I feel like I've heard that a little bit of fever can actually be good, like the body's fighting back. Is that true?
Yes, there's definitely truth to that. Initially, a mild or moderate fever can be beneficial. Well, the higher temperature can actually slow down the replication of some bacteria and viruses. It makes the environment less hospitable for them. And it can also sort of boost the activity of certain immune cells.
Interesting. So the body uses heat as a weapon, in a way?
You could say that, but, and this is crucial, there's a tipping point.
Right. When does it become dangerous?
The danger zone really starts when the fever gets high and stays there. If the temperature climbs above 105 degrees Fahrenheit, that's about 40.5 Celsius, we start worrying about significant dehydration and loss of appetite.
Okay, 105 is a key number.
And if it goes even higher, say above 106 Fahrenheit or 41.1 Celsius, that's when you risk really serious, potentially irreversible damage.
Like what?
Things like that brain swelling we mentioned, severe bone marrow issues, heart rhythm problems, electrolyte imbalances, organ damage, and DIC again. A persistent fever over 106 is absolutely a medical emergency.
Okay, that's critical for listeners to know. So, practically speaking, what signs might we actually see at home that suggest our pet has a fever, besides just feeling warm?
Good question. Lethargy is a big one, just seeming really tired, not wanting to move much.
Mm-hmm.
Inappetence, loss of appetite, not interested in food. You might notice faster breathing, tachypnea, or a faster heart rate, tachycardia.
Okay.
Sometimes their gums or the membranes around their eyes might look redder, more inflamed. And signs of dehydration, like sticky gums. In really bad cases, signs of shock weakness, maybe a rapid, weak pulse.
Got it. And when we bring our pet in, the vet's going to need more info than just he feels warm, right? What kind of history is helpful?
Oh, absolutely. History is hugely important. The vet will ask things like, has your pet been around any sick animals recently?
Okay.
What's their lifestyle? Indoor, outdoor, recent travel. Are vaccines up to date? Any medications, even supplements? Noticed any tick bites or other insect bites?
Right. Ticks are a big one.
Definitely.
Hmm.
And past illnesses, any known allergies, all that background matters. And a thorough physical exam, including looking carefully at the eyes, can reveal a lot.
Does the pattern of the fever matter, like if it goes up and down?
Interestingly, the actual pattern, spiking, steady, fluctuating, usually isn't that helpful for diagnosis on its own. It's more about the overall picture.
Okay, putting all the pieces together. So let's talk causes. This sounds like it could be a very long list.
It is quite extensive.
Yeah.
But we can group them. By far the most common category is infectious agents.
Makes sense. Bugs.
Exactly.
Hmm.
Viruses, think FIV in cats, parvo, distemper in dogs, herpes, calicivirus, bacteria, all sorts. Gram-positive, gram-negative, specific ones like mycoplasma, Bartonella, Leptospira, the Lyme disease bacteria.
Wow, okay.
Then systemic fungal infections, histo, belasco, coccidioids, rickettsial diseases like Rocky Mountain spotted fever, others like Ehrlichia, anaplasma, and parasites in protozoa Babesia, toxoplasma, heartworm causing inflammation, leishmania, cytozoon. The list goes on.
That really covers a huge range of microscopic invaders. What else besides infections?
Another major group is immune-mediated processes. This is where the body's own immune system goes rogue and attacks itself.
Autoimmune stuff.
Pretty much. Things like lupus, immune-mediated anemias or low platelets, pemphigus, polyarthritis, polymyositis, rheumatoid arthritis, vasculitis, even reactions to transfusions or problems caused by immune system defects.
Okay. Less common causes?
Well, endocrine and metabolic issues can sometimes be involved, but they're rarer causes of significant fever. Things like hyperthyroidism in cats, maybe very rarely Addison's disease or certain adrenal tumors called pheochromocytomas, hyperlipidemia, high sodium levels occasionally.
Right. And you mentioned cancer earlier, neoplasia. How does that fit in?
Yes, cancer is definitely on the list, especially blood cancers like lymphoma or myeloproliferative diseases, plasma cell tumors, mast cell tumors, also malignant histiocytosis, and sometimes solid tumors, particularly if they're metastatic, growing fast, or becoming necrotic, dying off, especially in organs like the liver, kidney, bone, lung, or lymph nodes. That inflammation can cause fever.
That makes sense. What about just general inflammation?
Yes, there's a whole category of other inflammatory conditions. Think cholangiohepatitis, that's liver bile duct inflammation. Inflammatory bowel disease, IBD, pancreatitis, peritonitis, pleuritis, even things like paniculitis, inflammation of fat, HOD in dogs, trauma, lots of possibilities.
That's a massive list. And then there was one more category that surprised me. Drugs and toxins.
Yeah, it's not the first thing people think of, but certain medications can induce fever in susceptible animals.
Like which ones?
Some antibiotics, actually tetracycline, sulfa drugs, penicillins, the antifungal amphotericin B, even things like barbiturates, high doses of aspirin-like drugs, some antihistamines, certain heart meds like procainamide,
Yeah.
and heavy metal toxicity.
Wow. Good to know that's even a possibility. Now, going back to that fever of unknown origin, FUO, are the common culprits different between dogs and cats when it gets to that puzzling stage?
Yes, there are some definite differences in trends. For dogs with FUO, infections are still very common underlying causes. Things like infections in the spine, discospondylitis, fungal infections, heart valve infections, endocarditis, hidden abscesses somewhere, sepsis.
Still lots of infection possibilities.
Absolutely. Also, immune-mediated diseases are high on the list for dogs: polyarthritis, meningitis, vasculitis, and bone marrow diseases or cancers. And that's specific Shar-Pei fever.
Okay, so infection, immune issues, cancer are big ones for dogs. What about cats?
Cats are a bit different. For feline FUO, viral infections are actually the most common identified cause, especially FeLV, FIV, and FIP, feline infectious peritonitis. FIP is notorious for causing vague persistent fever.
Ah, FIP, yeah.
Also, persistent hidden bacterial infections, sometimes from old bite wounds that never quite cleared up, things like Yersinia, mycobacteria, pyothorax infection of the chest cavity, systemic fungal infections, lymphoma, other tumors happen too.
That's less common in cats with FUO compared to dogs.
Interestingly, things like immune disorders, uterine infections, discospondylitis, pneumonia, and endocarditis are considered rare causes of FUO specifically in cats, where some of those are more common in dogs.
Fascinating comparisons. So, are certain pets just more likely to get fevers in general? Risk factors?
Yes, some factors can increase the risk. Recent travel, obviously, if they go somewhere with different diseases, exposure to sick animals, anything that weakens the immune system underlying disease, certain medications. And then the very young and the very old tend to be more vulnerable.
Okay. So, we suspect a fever. We're at the vet. What's the diagnostic game plan usually look like?
First things first, the vet needs to confirm it is a true fever and not just hyperthermia.
Right. Differentiate from just being overheated.
Exactly, like from heat stroke or even just major stress. Sometimes the vet visit itself can bump the temp up a bit. Generally, a temp up to maybe 103F might be stress or mild illness. Over 104F is almost always significant. And if it's way up, like over 107F, we're thinking more hyperthermia than regulated fever.
Okay. Rule out simple overheating. Then what?
The initial workup usually involves the basics, a complete blood count or CBC.
Looking at red and white blood cells, platelets.
Right. A serum biochemistry profile that checks organ function, electrolytes, proteins. And a urinalysis looking for infection, kidney issues, concentration. These baseline tests give a good overview and can point towards affected organ systems. An elevated white count might suggest infection, for instance.
And if those basics don't crack the case?
Then we dig deeper, especially if infection is suspected. We might move to cultures, urine culture, blood cultures. Multiple blood cultures are best practice.
Why multiple?
Increases the chance of catching bacteria if they're only intermittently present in the blood. We might also culture fluid from joints, the prostate, cerebrospinal fluid if there are neurosigns, or biopsy samples. Fungal cultures too.
Okay. Trying to grow the bug.
Yep. And then there are specific infectious disease tests. Blood tests like the LVFIV test for cats, the SNAP40X for dogs that checks for tick diseases and heartworm, and more specialized serology or PCR tests.
PCR, that's a DNRNA test.
Exactly. Very sensitive for detecting the genetic material of specific pathogens, bacteria, viruses, parasites, fungi. If there are tummy troubles, fecal tests are needed. Respiratory signs might lead to sampling the airways like a tracheal wash.
A very systematic search. What about looking inside? Imaging.
Imaging is crucial. X-rays, radiographs of the chest, abdomen, bones, even teeth or skull if needed. They can show tumors, fluid, pneumonia, bone infections, abscesses. Ultrasound is great for looking at abdominal organs in detail, liver, spleen, kidneys, intestines. And we can use ultrasound to guide needles for aspirates or biopsies. Echocardiograms, ultrasound of the heart if heart issues are suspected.
And more advanced stuff.
Sometimes necessary. Nuclear scans can look for bone tumors or infections. CT or MRI give incredibly detailed images, especially for complex areas like the brain, spine, or chest. There's even PT-CT fusion sometimes.
Wow. And what about more invasive procedures? When do those come into play?
Usually when less invasive tests haven't given answers. Things like arthrocentesis, taking fluid from a joint.
A joint tap.
Right. Bone marrow sampling if we suspect blood cancers or marrow disorders. Biopsies of lymph nodes, skin, muscle. Fine needle aspirates of lumps or organs seen on ultrasound. A spinal tap, CSF collection for neurological signs. Endoscopy for GI issues. And really, as a last resort, sometimes an exploratory surgery might be needed.
It really underscores that finding the cause can be a journey. So let's talk treatment. What are the main goals?
Two main goals, really. 1, lower the fever, make the pet feel better. 2, treat the underlying cause, whatever it turns out to be.
How do you lower the fever itself?
Supportive nursing care is key. IV fluids are often critical. They help with hydration and actually help cool the body down too.
Fluids help cool.
They do, by improving circulation and hydration. For really high fevers, we might use topical cooling fans, maybe applying cool water or rubbing alcohol to paw pads, groin, armpits. Gently, though.
Okay. What about fever-reducing drugs, antipyretics?
We tend to be cautious with those. They're generally reserved for prolonged, really high fevers, like over 106 F alpha. especially if cooling measures aren't working, or if the pet has other issues like heart disease or seizures, where a high fever is extra risky.
Why the caution?
Because fever can be part of the body's defense. And, importantly, giving antipyretics can mask the signs of the underlying illness, making it harder to track the response to specific treatments for the actual cause. So we don't want to jump to them too quickly unless necessary.
Makes sense. What about feeding them?
Diet is important. Febrile animals are burning extra energy. They're in a hypercatabolic state, so they need more calories. Easily digestible, appealing food is best. Maybe small, frequent meals.
Good tip. And for owners facing FUO, it sounds like they need patience and potentially deep pockets.
That's a tough but necessary conversation. Yes, diagnosing FUO can be lengthy, involve many tests, potentially specialist visits, and it can get expensive. And we have to be honest that sometimes, despite everything, a definitive cause isn't found.
Right. What about specific medications? Antibiotics first. When are they used?
Ideally, antibiotics are chosen based on identifying the specific bacteria and what it's sensitive to from culture results.
Right. Targeted therapy.
Exactly. We try hard to avoid just throwing broad-spectrum antibiotics at a fever without a diagnosis, unless the pet is critically ill. In that emergency situation, we take samples for culture first, then maybe start broad coverage while waiting for results. Using ineffective antibiotics long-term is pointless and risks resistance.
Okay. And the antipyretics themselves. Which drugs are used?
For dogs, options might include dipyrone, NSAIDs like daracoxib or meloxicam, or flunixin maglumin. For cats, we have fewer safe options. Aspirin is used sometimes, but very carefully. Meloxicam is also used, again, cautiously and at lower doses than dogs. Flunixin can be used in cats too, but often with IV fluids and careful monitoring.
Important differences there. What about steroids, glucocorticoids? When do they come in?
This is really important. Steroids like prednisone should only be used for fever after infectious causes have been confidently ruled out.
Why is that?
Because steroids suppress the immune system. Giving them to an animal with an undiagnosed infection can make things much, much worse. And they mask signs, making diagnosis harder. Their main role is for proven immune-mediated fevers, or maybe some steroid-responsive cancers, perhaps as a last resort in cats with intractable FUO once infection is excluded.
Got it. Steroids are a definite rule-out infection first situation. I saw phenothiazines mentioned too.
Yeah, drugs like acepromazine, they can lower temperature by affecting the brain's thermoregulation and causing blood vessels to dilate, releasing heat. But they also cause sedation and can lower blood pressure, so they're used cautiously in specific situations, usually under close monitoring.
Okay. Any major side effects or precautions for owners to know about with these fever meds?
Definitely. NSAIDs, a common type of antipyretic, can cause GI upset, vomiting, diarrhea. More seriously, stomach ulcers, kidney, or liver damage are possible risks, especially with long-term use or high doses. And crucially, never ever give acetaminophen to cats. It's extremely toxic to them. Also, combining NSAIDs with steroids, or even using two different NSAIDs together, dramatically increases the risk of serious GI bleeding. Avoid that unless specifically instructed by your vet.
Very important warnings. Finally, what's the follow-up look like once a pet is recovering from a fever?
Monitoring is key. Regular temperature checks, often at least twice a day initially. If the cause wasn't found, the vet might need to revisit the history, re-examine the pet, maybe repeat some tests if the fever persists or returns. We also have to consider hospital-acquired infections if the fever develops or worsens during hospitalization.
Okay.
The prognosis, the expected outcome, really depends entirely on the underlying cause. Sometimes it's straightforward, sometimes it's complex, and sometimes, particularly with feline FUO, we manage the signs without ever finding the exact trigger.
Wow. This has been incredibly thorough. It really paints a picture of fever, not just as a symptom, but as this complex whole-body response with a huge range of possible triggers.
It truly is.
And I think the big takeaway for everyone listening is that a high fever, or one that just won't quit, is definitely serious and needs veterinary attention to figure out that underlying cause.
Absolutely. Prompt investigation is key. And it highlights how intricate the body's mechanisms are.
It really does. Which leaves me with a final thought to ponder. If the body uses something like fever, which feels so negative in such a complex way, potentially for defense, what other symptoms we see as purely bad might actually have some hidden, maybe beneficial purpose we don't fully appreciate yet?
That's a fascinating question. Definitely food for thought.
Indeed. Thanks so much for guiding us through this deep dive today.